Okay, I think we're ready. Did you like the souvenir pen? I only had one.
Loved it. Loved it. I have it. I'm going to get it free.
Oh, you kept it? Okay.
Yeah, I got one.
Nice. We might have more as we sign stuff, so. We'll spread the love. Okay. We're going to get started here with our Corona briefing. And as usual, what we're going to do is begin with some updates from our Joint Information Center that's been managing things throughout the pandemic for Central New Mexico. And then we're going to talk a little bit about where Bernalillo County and really the ABQ metro area is at. And so for us, you know, I think we heard lots of good information from the state yesterday, so we're going to focus specifically, obviously, on the Duke City and our situation that we're in and in terms of what we've really got to do given all the circumstances. And then we'll take questions on whatever issues at the end, as always. So let's begin with some updates from our Joint Information Center. First, Presbyterian is going to remain open at the Balloon Fiesta for 7 days a week. They're back to a 7 days a week schedule because of the increased testing demand from the community. Those hours starting tomorrow are going to be weekdays from 7 a.m. to 3 p.m. and weekends 7 a.m. to 1 p.m. And again, that's the partnership between the city and Presbyterian out of Balloon Fiesta Park. Great use for our Balloon Fiesta Park in addition to movie night, which started last night. Drive-in movies are back in Albuquerque. And during the day, you can go get tested. So there's also a testing site at New Mexico, Expo New Mexico, which is open Monday through Saturday from 8 a.m. to 10 a.m. Very good option for folks in the center of town. The Loveless testing site is back open from 7 a.m. to 12 p.m. on Monday, Wednesday, and Friday. UNMH is also providing asymptomatic testing for patients on Monday, Wednesday, Friday from 7 to 11 a.m. in the COVID-19 testing area. That's the tent outside the Bill and Barbara Richardson Pavilion North entrance. All systematic patients will continue to be seen on a 24/7 basis in the BBRP conference room number 1500. The New Mexico Tax and Rev Department is extending some modifications to its collections and enforcement efforts through July 31st. These modifications were originally announced on March 31st, and they're a way to help taxpayers facing financial difficulty because of the public emergency. And the most severe collection activities, including liens, seizures, injunctions, are now on hold through July 31st. And district offices are accepting appointments. For those who need to visit with them, please book them online at tax.newmexico.gov. Okay, now let's talk a little bit about where we're at in terms of the city and the pandemic. We're going to mention a couple of things sort of in terms of what we've been doing over time, and then we'll talk about our situation and what we've got to do going forward. So first, I want to mention that people continue to step up in the city of Albuquerque, and our donations, for example, continue to come through. We have 157 donations received by Albuquerque departments. We've received almost $30,000 in donations. We've also received 7,000 face coverings and 3,000 bottles of sanitizer. So we want to thank everyone for helping out in each and every one of those ways. And the total value of those donations so far is just under $200,000. And we also know that early on, we're going to look at some curves and some graphs here, but early on we worked hard and we were really able to flatten the curve here in Albuquerque. Of course, now we're seeing that curve ramp up tremendously, but we want to remember what we demonstrated before because we have to demonstrate it again for our city. And as another reminder with respect to real problematic areas like nursing homes, we were able to get La Vidiana to a COVID-free status after a significant outbreak, and we're continuing to try and do that at other nursing homes around the city. But nursing homes do continue to be a challenge. Now, we also met our spread rate goal early and actually for the gating criteria, but of course now we're seeing those spread rates all go up and go the wrong direction outside the gating criteria. Now, I also want to mention that in many ways, we'll talk a little bit about this, Albuquerque around the country has actually been pointed to as a place where, on a relative basis, especially compared to big cities in the region, we actually did a tremendous job propping up our small businesses, propping up our economy, and having lower spread rates, lower case rates, more bed availability than all our peers in the region. We'll talk a little bit more about that. But we're going to have to go through this process basically again and demonstrate that leadership once again. Now, also with respect to masks, our city continues to find ways to demonstrate the distribution of masks. Recall that I think it was last week we announced that we've purchased over 6,000 masks from a local nonprofit that works with immigrant families and makes masks for the city. That number is about 6,000. We're going to continue that program, and those are also where many of the masks that we hand out come from. So special shout outs to Southwest Creations Collaborative Creations for being our partner with respect to making masks for folks in need. I think it was also near the end of April, maybe the end of May, when I first wore a face mask, and I think it turned out on Twitter and social media, I think we were one of the first major city mayors to do so, at least one of the first 5. And this is something that I've been doing ever since, but it's something that we all need to do. And we're going to talk about the new state order with respect to masks. But for us, for many of us in Albuquerque, the vast majority, right, we've been trying and we've been using the masks. We've just got to do more. And for those who haven't been, it's now time to start. Now, a couple of other items to mention is that all our first responders should have masks that are available to the public. So if you do see, for example, a firefighter, something of that nature, or one of our police officers, and you do need a mask, feel free to ask them. They should have them, unless they've just recently run out. Now, let's look at our first slide here. And this is a chart that really depicts a couple of things in the city of Albuquerque. Now, I think first and foremost, we want to highlight what this is. This yellow line is actually this is the 7-day average of deaths. And so we see, it obviously went up here and then it kind of went down, and we see a little bit of a spike at the end. And, we'll see what happens. There are some demographics at play with respect to more younger folks coming down with corona, and then the survival rate tends to be much higher. So we obviously want to see the death rate as low as possible. And so we'll see where that goes. Right now, we were doing a really good job in here, and again, we'll see what happens in the next few weeks. But obviously, I want to highlight the number of cases identified. So this red line here, look how we went up here, and then we did a good job dropping down and really plateauing. But then up here, we see this big spike, right? And this actually is not particularly surprising. This is what every major city in America is seeing. And in fact, we were actually seeing it a little bit later than those. But it is here, it is back, and we see it in these numbers. And I want to mention that our team, our Director of Environmental Health, is going to speak in a little bit. We've been preparing for this. This is something that we saw happening really in the beginning of June, and we were concerned that it eventually was going to spread to Albuquerque. We were actually able to hold it off for a couple of weeks longer than we thought, but it is certainly back and here, and unfortunately corona is a big part of any urban area in America right now. And this also, of course, the dynamic is worse for an urban area that is surrounded by a rural area. So if you look at comparative cities, whether it's Denver or Phoenix, all of these challenges happen similarly in Albuquerque, because we know that folks from all over the state and even all over the region come to Albuquerque for their health care, for the mall, for the airport, for our hospitals. This has always been the case, and we have always stated that we expect actually our rates to be much worse than the rest of the state. I think the interesting thing back in April and May was that things were so bad out in the Northwest and on our reservations that it really hid the fact that the urban areas are usually hit the worst. And so fortunately for those areas in the Northwest, those areas now seem to be going down and a little bit more under control. And we're actually seeing what is a expected pattern, which is that when you've got over 50% of the population in the state and the vast majority of the services, you're going to see these kinds of numbers. So what we've got to do in our city is really step up to deal with this dynamic. So for us, we know that the virus is still here and the risk is still here. And in fact, it is getting worse. Now, this is the same story statewide as we heard yesterday. We are all in this together, and I think most importantly for folks in Albuquerque, again, we're in this with the rest of the state, and unfortunately, in this case, our border regions, right? We know the situation is much worse in Arizona and Texas, and to a certain extent Colorado, but we also know that there are people who live along that border who end up and have family in Albuquerque. And so that kind of transmission is inevitable, and that's exactly why we're doing some of the things around quarantine and even around some of these closing of state parks to folks from out of state and so forth. And we'll be looking at similar measures next week in the city with respect to that. But we also know that some of this is just the inevitable fact that we're the urban center for about 1,000 square miles. So we also understand that there's just some things you can't completely control. Now, with for each of us, we also, I think, play a direct role in this. And this is where I think masks are so important. Wearing a mask is really the only thing right now, other than, of course, washing your hands, staying at home when you can, and staying 6 feet away. These are the 4 things that we know all across the country and all across the world help. And these are the 4 things we should all try and do. I want to mention, though, that it's not often that simple. And I want to begin by also stating there's a lot of corona fatigue, or whatever you want to call it, but it's real. I know we're tired of this. I know we want it to go away, and I'm no different than anyone else out there who feels that way. Unfortunately, it's just not our choice. It doesn't matter how we feel about it. And so we've got to find a way to understand that on the one hand, our lives were changed overnight when this started, and that many folks lost their jobs. Folks have lost their child care options, and life as we know it has been turned upside down. And some of us buckled down for a while, and now we're also tired of it. And some of us want to go back to normal, and it's getting harder not to get more complacent. But for us, I think the virus, like so many other situations all across America, has also become extremely polarizing. And this is, again, something that we are layering on top of a virus that doesn't care where we live, or what our family situation is, or what our politics are. And so we've got to remember what we're fighting here. We are fighting a virus. We are not fighting each other. And we are not fighting messaging. We are not here to shame each other. We have to rise above this concept of shaming one another, whether it's about any of these actions or how certain people are dealing with the situation. But we do have to remember we have a common enemy to defeat, and that is the disease that is claiming the lives of New Mexicans. And that's what these 4 things can help us do. Now, it also means that we've got to follow the data. We have to respect and follow science. But we've also got to understand that science continues to change and opinions continue to change on this. And that's okay. That is just part of the uncertainty of the world that we're living in. And so I think it's important to remember that we've got to do the best that we can. We've got to make it data-driven. We also have to remember that there is no absolute truth. And we learn each day and we adapt. That's what we need to do, instead of trying to understand that something is going to be permanent and that will be the case going forward. We just can't say that right now about anything with respect to this virus in our country. But we can take action today by doing those 4 things. Now, it also means that we've got to acknowledge that whether it's a country, as a state, or a city, we have to continue to learn, and as I mentioned, continue to adapt. And that's what our city is committed to. Because I think inherent in this concept that we have to deal with uncertainty, we know that we all have to make some judgment calls that are based on the best science of the time. And we've got to do all that we can. But we also have to acknowledge that if these patterns continue across America, we are going to be in a situation that we have to deal with for months, maybe 12 months, maybe 18 months. So we've got to do what we can today, but we also have to mentally get ready, and as a society get ready, that things aren't just going to go back to normal, and that magical V-shaped recovery I was hoping for in the economy might not happen. And we've got to start preparing and getting ready for that. And that's what Albuquerque has been beginning to do, and that's what we're going to really start working on next week. So a couple of other items in terms of what we have learned. We know that our city, when all of this happened beginning back in April and March, we know that a lot of people were falling through the cracks. And what the coronavirus did is it really highlighted where those cracks are and how big they are. And we also know that this meant a lot of people in our community, especially folks with income challenges, folks with pre-existing health conditions, were especially vulnerable, and they were fearful for their lives and their livelihoods. And our city actually stepped up to try and provide a safety net. We provided 200,000 meals for seniors. We provided childcare at every single one of our community centers for working families. We provided rental assistance. We provided medical care for the homeless. And we are still doing every one of those activities. And we are poised to ramp those up if we see these numbers continue. Now, these vulnerable populations, I think it's also important to remember that these are our loved ones. These are the reasons why we need to wear a mask, why we need to keep physical distancing, why we need to wash our hands, why we need to try and stay home. But I also want to mention that for everyone, sometimes things like staying at home is a luxury. And so we'll talk about this in a little bit. But we still have to understand that it can be complicated if you have 2 kids and you're a single parent and you have to work. That's what the city is trying to step up and help with in terms of our safety net. So we are also knowing that we have to do enforcement. And so our city continues to enforce all the state public health orders. And we do that through a multi-department effort, through our fire department, our environmental health department, which does code enforcement, and of course through the police department. And we will continue to do that even with the new order. Now, we also know that businesses are really struggling. And so I want to touch on a couple of things here. With respect to businesses, our code enforcement team and our fire marshal is going to be working with businesses to enforce the wearing masks state ordinance. Now, we also have this placard here. Remember the old saying, like, no shirt, no shoes, no service, and just to add in masks, right? This is the concept. It's the notion that any business does have the right to refuse you for reasons such as this. As a reminder, they do not have the right to refuse you for any kind of racial discrimination or things of that nature, but they do with respect to areas around sanitation and health. And so this is a placard that's available if folks want to download it. And this is, I think, just a good thing to remember for businesses. And if they're having particular challenges dealing with this, we know this has been a big problem with big box stores and a lot of chain restaurants. And this is where we're going to focus our enforcement efforts. So we'll be working on that over the weekend. Now, this is also part of how we need everyone to play a part. We want to keep these businesses open. And so to keep them open, they've got to follow the mask rule. That's very, very important. Okay, now for us, we also want to mention that as the state outlined, there are some good things you can use, and we'll go to the next slide here, with respect to basic principles of risky behavior. And so the concept now is really what you want to avoid and what we want to reduce is closed spaces and crowded places and close contacts. And so you can see them outlined here. This was from the slide before, or from the presentation yesterday. And when those 3 things come together, so in this intersection right here, this is where, as an individual, as you're thinking personally about, like, what am I doing this weekend? Avoid anything that is the overlapping of these circles, if not the circles in general. But that is really where we are seeing the spread nationwide happen. And we know that as a urban area, this happens. And that's also why the restrictions around restaurants and so forth were put in place, because that really defines the center of these. And of course, you know, unfortunately for folks who really want the bars to open and nightclubs and things like this, you can see how that falls in the dead center here. It's one of the most dangerous things we could do right now. So that's why they're not allowed. Okay, now I do want to touch a little bit around the connection between enforcement and equity. And we have seen a situation, just as a small reminder, that we know that we've got to do enforcement on all the health ordinances, but we also know that we have to respect a couple of things with respect to civil rights. And so first, let me just outline where we're at in terms of compliance. We've issued over 60 warnings in the last week about face masks and other violations of health orders. And we also gave out information 270 times. That's sort of our education number. We received 119 complaints, and we educated 401 businesses. And the vast majority of these were food establishments, salons, grocery stores, and smoke shops. We got 117 calls to 311 over the same time frame. and just over 50 calls into APD. Now, as I share these, I think it speaks to a couple of things. One, I think it speaks to the reality of our city actually working on education and enforcement. It also reflects the fact that people care and they're calling in, and that's good. But also, these numbers aren't through the roof. I mean, just for an example, on 4th of July, we had over 600 calls about fireworks. So I think one thing is we see a sort of relatively stable situation where hopefully we can take those calls, learn, get our folks out and do education. And so right now, that's how the numbers are playing out. And we want to also try the best that we can to get parties identified with respect to quarantining and then closing businesses and disinfecting when they do have a positive, especially in a restaurant or a public place or even the workplace. This also helps us catch folks through tracing and, of course, trying to get folks who might be asymptomatic and saying, please get testing. Now, with all of these practices, from masks to staying at home, we also know that we have to use a equity and social justice lens through some of this, and also understanding areas around civil rights. We've seen that as our nation's attention all of a sudden has totally shifted from coronavirus to things like the Black Lives Matter movement and social justice, now back to the coronavirus, we've got to remember that part of this is deeply interwoven together. And so I want to remind everyone that our response has to be thoughtful, it has to be pragmatic, and it has to understand equitable factors. Like knowing the fact that low-income folks, mostly people of color and experiencing homelessness, are often unfairly targeted or shamed for non-compliance. We're very sensitive to this, and we're not going to be doing that. We also know that the luxury of staying home and still trying to keep your job, we have to find a way as a society for people, when this is a reality, to allow both of those things. They've got to be able to stay safe, but they also have to be able to keep working. This is going to be our challenge over the next few months, if not the next year. We also know that for working parents who have to choose between keeping their kids safe and paying their bills, we have to do something about that choice. We need help nationally because at the federal level, there is not a coordinated response on this, and that's really what's driving this terrible trade-off. And that means that at the city and also at the state and at the county and at every level of government, we've got to step up and make sure that parents are not having to make that choice between keeping their kids safe and paying the bills. Now, we also know that this has been a polarized debate, and we cannot forget every day that there are residents who are here trying to stay healthy and make a living. And we've got to find a way in Albuquerque to make sure that people can do that as best that they can. And we have to respect the stress and the challenge that comes with a trade-off that they might be having to make between those two things. Now, we need to talk a little bit more about exactly how this is playing out in the city of Albuquerque. So I'm going to take a pause and hand it over to our Director of Environmental Health, Ryan Mast. Ryan.
Thank you, Mayor. So from an emergency operations standpoint and how the city's been really adapting to address the need with regard to this pandemic, just as the Mayor pointed out earlier, and as the virus itself has sort of shifted its sort of prevalence in our community, we've also shifted our operations to meet that need. Early on, we were very much in an emergency response stance to this outbreak, and so some of our earlier concerns and efforts were really focused on containing the outbreaks in areas where the most vulnerable populations were. So this includes people experiencing homelessness in our nursing homes, and then also making sure we're allocating resources to the medical field to make sure they have enough that they need to respond. As a result of that, we stood up and managed hotels that housed 600 people who needed to isolate when they were getting tested for coronavirus and had nowhere else to go. We supported more than 20 nursing homes to help them address their outbreaks in reducing their infections and in some cases even eliminating them. And during that time, we also fulfilled 1,500 resource requests for local entities responding to this emergency, including the healthcare system. So while the city still stands ready to support those ongoing needs, and we have those teams available to continue to address any of those serious concerns, we've also shifted our priorities to address the new trends that we're starting to see with this outbreak. And that includes sort of really focusing now on the public health campaign that's related and responsible for how we're going to manage this moving forward. So I think even as Albuquerque and New Mexico as a state has been doing better than our neighbors, that's really attributed to the way and all the efforts that we've put forward to address this, especially early on. And those same trends, though, nationally are now starting to play out here, and we need to make sure that we're also shifting our priorities here to address that. So the first thing that we want to notice that was kind of pointed out yesterday in the governor's press conference, but we are also definitely seeing play out here in Bernalillo County and the Albuquerque metro area, is that the case burden is really shifting now to younger adults. So we have here just a graph that sort of illustrates between May and July the percentages of cases by age in Bernalillo County. Now, a lot of them are very similar, but the one thing that's notable here is outside of the 9 to 19 and the 20 to 29 bracket, everyone else is reducing, and the 20 to 29 has gone up dramatically. Now, these shifts may seem minor when we compare them side by side in overall case totals, but what's really reflected in this is over the last 2 weeks, a third of our new cases have been in that 20 to 29-year-old bracket. Now, while the effects of the virus appear to be much less severe in younger people, any growth rate in our community puts everyone at risk. And that greater risk has the greater risk of also increasing the chances that it's going to get to those who are more vulnerable and who are going to experience those more serious outcomes as it relates to this infection. And we can also attribute that to what we're looking at when we look at our hospital resources, because it's important that one of the major priorities remains reducing those most critical cases, which could overwhelm our local hospital system. So right now we're looking at the tracking where we're at with regard to emergency department beds, ICU beds, as well as ventilator use here locally. The solid lines below here that sort of jump up and down are the uses in case, and the dotted lines on top represent what our capacity is. Now, throughout this, while we can see we're maintaining that underneath the capacity, so we're still really good, and that's a good sign compared to some of our peer states. Throughout this also knows that, like, at any sort of time, if that starts to shift, that trend starts to shift back to where we were at the early stages of this, that we could overwhelm that system still. I also wanted to point out that this is including total use, right? So this includes both those that are there for COVID-related illnesses as well as others. So while this is remaining pretty steady, it's a result of, like, as the activities return back to normal, some of the other things that cause folks to go to the hospital and be in these is included in this number. So there's an opportunity to shift in there. We're within our bounds right now, but we need to make sure that we're tracking that and not overwhelming that system. The state's mandate for wearing a face covering in public is going to be adjusted right now, and it's been in place now for 2 months. And the shift that's going to happen now is that it's being extended to requiring face masks while exercising. So essentially, anytime you're out in public, whether it be a retail shop, a workplace, a restaurant, and now while walking and exercising or taking public transit, you are now required to wear a face mask. There are a couple of exceptions that do remain in place, and that includes eating and dining. But if you want to eat or dine at a restaurant, you have to have a face mask in order to enter, and then also put that back on if you're doing other activities, such as using the facilities at the restaurant. So this is a very common practice, and that we've been going through over the last couple of months. We just need to make sure that we're continuing to enhance while we're doing that and being very diligent about doing it. I think one thing that's important to note here is that that there is a fatigue around this. It is very difficult to continue to remember this. We've been doing this now for several months, but this is the norm. This is a normal practice that we have to really continue to be diligent about in order to avoid any of those adverse impacts. I know this is very challenging. As the mayor mentioned, it's challenging to all of us. The fact that we've had to adjust how we work, how we play, how we socialize, how we do daily tasks, how we celebrate with one another, how we grieve with one another, this is all change. But we can't allow those changes in that to get us go back and be complacent that this virus is not very real and very active in our community. And we have to remember that in order to continue to stem this tide. And this includes also helping out with our local businesses as they work to adapt. The mayor mentioned some of the statistics in terms of the number of complaints. Our department has been front and center with regard to responding to a lot of the complaints and to support the enforcement of the state's public health orders. We also have been checking for COVID-safe practices during all of our routine tasks. So all of the statistics that the mayor mentioned doesn't even include the hundreds of routine inspections that we do that now include all of those checks for those same practices. But one of the things that we're really noticing is we're seeing a huge uptick in volume for complaints. but that a lot of those complaints are also complaints about members of the public refusing to wear masks while in these businesses. The businesses are required now to inform you that you have to have a mask to enter their facility, and it's really tough on them to have to do all of the enforcement pieces to this, and we recognize that. So we're really asking the public to do their part to help out our businesses just as much, because they are also experiencing all the same challenges that we are with this, and they are doing their best to come into compliance, and it's up to all of us to help them. They're struggling to know how to intervene, and they certainly don't want to have any escalating situations, just like none of us would. So let's try not to create those situations for them, to just wear a mask while you're public, especially when you're in those closed spaces. To speak a little bit of the effectiveness of this and why it's such an important mitigation measure, the science is now pretty clear. Early on, they talked about that wearing a mask can cut the infection rate of you infecting someone else by up to 60%. There's more and more evidence coming in now that it also provides a very relevant protection to the person who's wearing the mask. So I know it's uncomfortable, especially now that we're in the heat of the summer and it's hot, and these masks only make it hotter. But the alternative, with regard to the danger of lives, for the jobs that we have to continue to bring back to the city, as well as the economy, is far more uncomfortable than anything about wearing a mask. So just reflect on what we've been doing that's gotten us to this point, and everybody, please be diligent as we move forward to make sure we continue to do that. So I'll turn it back over to the mayor.
Okay, thanks so much, Ryan. And I think, let us just wrap things up, at least for now, by talking a little bit about our city and the longer term. And I think we know that as a city, we've got to do all that we can. We've got to wear our masks, we've got to wash our hands, we've got to stay 6 feet apart, and we need to respect each other in the process. And for us, though, we also got to prepare for the long haul. And unfortunately, all across the U.S., we're seeing that there is no silver bullet in general without a vaccine. And so we want to remind folks that until that's the case, we are going to be going probably through these ebbs and flows with respect to the virus. And we know that even with strong compliance, we're going to be able to save lives. That's very, very important. But we also have to understand that it's likely that cases will continue to increase, and that we need to prepare for how to deal with this for at least the next 12 months. And so for us going forward as a city, we're going to be working on scenarios for how to keep the safety net in place, for how to support the most vulnerable, how to keep our city operating, how to think about how to keep our economy up and running. And that means even if these kinds of restrictions are in place for months and months, that's what we have to prepare for. Now, we also know that this city has demonstrated over the last 4 or 5 months that we've been one of the healthiest large cities in America. We have had better than most of our peers' spread rate, positive case numbers, testing ability, availability of beds, ample outdoor recreation, and it has provided hope for all of us. And it has demonstrated that actually Albuquerque has been a leader, relatively speaking, around the country when it comes to dealing with the coronavirus. And all of a sudden, those cities that used to be cities that everyone in our town maybe wanted to go to, like Denver and Austin and Phoenix, they don't look so good anymore. So I'm still proud of our city. I still believe we should be proud of our city. And we stand out as an urban space that is a place where going forward, once we get through this, and even as we're going through this in the long term, people are recognizing the fact that this actually is a better place to live. It's a better place to have your business than a lot of these other cities that used to outcompete us. And so for us, we have to work hard to make that continue to be the case. We have a basis for hope. But in the long term, it's going to take real resilience and deep conviction that we can do this in Albuquerque. So with that, let's take some questions.
Thank you, Mayor. We have one question here from Chris McKee at Keller News. The governor has called on law enforcement across the state to pursue aggressive enforcement of face mask wearing. Are you directing APD to write tickets or issue citations if those who are not wearing masks?
So questions about enforcement. And so first of all, before I get to that too, I just want to explain this slide. So this slide is the cases per 1,000 people, so it's adjusted for population in the major areas that we compete with all around us. And you can see just a huge stark difference in Albuquerque. So while we know this is a problem, while we know we have to save lives, I think it's also important to remember that we are doing a much, much better job than these other cities. And I want to make sure we keep doing that. Okay, so to the question, I think as we stated, it's pretty clear we're doing lots of enforcement. In fact, basically none of these health orders are even going to work unless we do enforcement. And that's what we have been doing, and that's in large part why they have been working. Ryan mentioned the hundreds of education efforts and enforcement they've been doing. I cited some of the statistics in terms of what our police department and our fire department's been doing. And of course, if there's egregious situations and so forth, they're going to do things like citations. But just as we have before, we want to have a proportional response. Our goal is to bring people into compliance, not to punish people.
Thank you, Mayor. We have a question here from Joy Wing at KOB. She said that viewers are saying that they're reporting the same establishment, but that same business has not come into compliance. How do they know that the business has received a warning, or what steps are being taken?
Questions about a specific business, I would say just ask. So the reporter can just ask us too. If there is a situation where someone's resisting compliance, as we did before with smoke shops, we will close them down ourselves.
Okay, and we have a question here from Jessica Dyer at the Albuquerque Journal. She says you alluded to some possible announcements next week. Are you planning to implement more stringent rules than the state has for the Albuquerque area?
So we're going to look at all the options. We've always said from day one that just because of the fact that, again, we are the largest urban area in 1,000 square miles, we might have to take some alternative measures compared to the state to keep this in place. And so we're going to look at a lot of different options next week.
Okay, a follow-up here from KRQE News on the mask enforcement. Based on the numbers you mentioned, it's clear that APD has issued lots of warnings and education efforts. They're asking why police have not written citations yet.
So I think the state police have written one citation. I think there's only been one citation in the entire state. So that our department seems in step with what's happening around the state. And again, our goal is compliance, not punishment. So as long as people comply, there's no need for a citation.
Thank you, Mayor. Another question here from KRQE asking for your response to the thought that some people won't wear a face mask unless they're given a ticket or citations for not following it.
I mean, if they are going to refuse to leave a business and that sort of thing, or get in some sort of altercation, then of course we're going to take appropriate law enforcement action. Fortunately, that hasn't happened, other than I think the one situation we heard of at one of the stores, in which case we did take action. So again, we want to proportionally respond, and so we'll continue to do that.
Follow-up question from the Albuquerque Journal. What kind of additional measures are you considering?
We'll see next week.
A question here from KOB. Can you elaborate on the store that the city did take action on?
Yeah, so there have been some questions about a pet store incident, and I want to emphasize that a police report was filed by the clerk with APD. And so there's been some myths around this, so at least let me tell you the information that I have. So the police report was filed. APD coordinated with Rio Rancho Police Department because the perpetrator in this case lived in Rio Rancho. And so the Rio Rancho Police Department did contact the individual at his residence, and that officer did not file a report. APD did file a report and has submitted the case to the DA for aggravated assault. And so there was no off-duty officer at the store when this happened. And again, there's a lot of stuff going around on social media, but that is, again, there was no off-duty officer at the store when this happened. And again, the jurisdiction question is just the individual lives in Rio Rancho. So the not filing occurred in Rio Rancho. We did here in Albuquerque.
And a follow-up question from KOB. She's saying, was it someone refusing to wear a mask in the store?
Yeah, the question is about what exactly happened in the store. It's a good question. What I would do for that one is actually just call EPD, and I know the reporter can do that, and we're happy to fill you in on the details of that. I personally don't know exactly what happened in the store.
I'm not seeing any other questions coming in right now.
I got it.
Go ahead.
I mean, you mentioned that you're going to, you're very proud of our numbers right now in the metro, and you're happy to keep it that way in a low circumstance. You said that you're going to adjust some things possibly next week. Is there a certain data point that you're looking at that you want to base your decision off of?
Yeah, sure. So the question is, kind of what are we looking at and where are we at? I think there's and again, I'm gonna give people the straight reality in a sense that there's some numbers that we're not proud of at all, which is the first curve of the fact that our cases are going way up. What we are proud of is the fact that we continue to be a much healthier place than all the major cities around us. So what we've got to look at next week, what we're looking at is a couple of things. We're trying to understand if there's specific hotspots in the city or areas where spread is a increased issue compared to the rest of the city. So we're going to try and look at that, so some geographic considerations. We're also going to do things like look at areas where travelers are coming in. For example, our airport, also things around wherever we might have folks, again, from out of state gathering in Albuquerque. We're going to really look at that. And we're going to look at the death rate. I think this is also, a big issue. We're seeing across the country because, as you saw from Ryan's presentation, the fact that 20 to 29-year-olds are now this huge spike and everyone else is going down, hopefully that means the death rate won't increase as much, just because statistically they tend to be healthier. So if that changes, though, that could be a real problem and stress on our health system. And that's why we might have to go back to this situation where we're looking at setting up emergency shelters and things of this nature. And we also got to keep an eye on our homeless population. Again, we have been testing our homeless population. Relatively speaking, our city has done a great job dealing with corona and our homeless population. But if things start spreading in that area, we're also going to have major, major challenges. So those are the kinds of things we're looking at.
Speaking of the homeless population, I mean, this weekend it's supposed to get it up to 103. Are you guys looking at any cooling centers or anything to help this? And is there a concern of COVID in those situations and spread?
So I think because of corona, we're set up in a way where we can deal with this in a similar way as we have every year when it hits 103 and we have a large homeless population. But now we have more centers available, and our administration has kept the West Side shelter open during the day. That was never the case until we came in. So the best thing folks can do is just stay at the shelter during the day.
Thank you, Mayor. We have a couple other questions coming in. Jessica Dyer with Albuquerque Journal is asking if you would implement restrictions in just parts of the city.
Yes, absolutely. That's something we'll consider.
Okay. And then a few follow-up questions from KRQE News. Where do you feel APD should draw the line when it comes to education versus citations for mask wearing?
So the question is about kind of where to draw the line. I think that's really a good question for our law enforcement folks. I think you got to make sure, again, we're after compliance, not punishment. And so certainly if people are complying, there's no need to do anything else. We also understand, similar a little bit to fireworks, there statistically is going to be way more cases of non-compliance than we can ever respond to. So we want to set an appropriate example, let people know we'll hold them accountable, but we also have to be realistic and pragmatic and understand that we are not going to do things like set up checkpoints all over town to check masks. We've got to fight violent crime. We've got kids who were shot in our parks. These are the issues we need APD focused on.
Okay, and final question from KRQE News is, doesn't it seem as if most people should know the rules by now in terms of wearing masks?
They should, and everyone should wear a mask.
Okay, that's the final questions from Zoom. So we're good.
All right. Okay, I think we're good. We will see you next week. Thanks so much. Have a good weekend.